Hi everybody, it's Dr. Don Hayes again, and I'm sitting here with my wonderful patient Virginia. We're having a great discussion. We decided to turn the camera on once again because she was gracious enough to share her story with us a little bit earlier, but then you started to tell me about the impact of the medication on your life, the medication on your lifestyle. So tell us a little bit more about that and how that affected you.
Well, when I went through all the testing that was done, they came up, they did all these horrible, painful tests, electrical charges going through my body, and in the end they sat down and told me that that they could give me shots in my back, or they could sever a nerve in my back and it would help the problem. But it's like, what about my feet? You know, if I can't walk, I can walk my back out. It was my feet, and they refused to focus in on it. So I ended up with medication that was so debilitating because it took away all the things that I love to do. And I couldn't concentrate, I couldn't think. But when I wasn't on the medication, there was just so much pain. And I just got to the point where I really felt like I didn't want to live.
Right.
You know, and here I'm reading about the medication that I'm taking that's supposed to make me feel depressed. It wasn't the medication that was making me feel depressed. It was the actual pain that was making me feel depressed.
So here you are less than 4 weeks later. 4 weeks later,
and the last time I went to a doctor, he told me, there's not going to be any more, it's not going to get any worse, and it'll never get better. And I was so hysterical in the parking lot, I couldn't even drive. I had to sit there and just let my tears out. And that was, it was when I decided I had to do something non-traditional, that I had to try this, because I couldn't go on the way I was going on. It was, and I'm the most happy person you could ever meet. I love life. I want to live every moment of it. And I got to the point where all I could do was lay on my bed and put a fan on my feet or ice my feet, or, and now I don't have to do that. I go to the gym all the time now, and first we started with machines where I didn't have to move my feet. Now she's got me running around the courts, and I'm like, look at me, I can run. And my feet are part of my body now.
Absolutely, good.
I can use my hands, I can use my feet, and I can use my mouth.
Just another real fine example of many of the case studies we've described where patients literally do have, misery to miracles in 5 weeks.
But it was just the no hope that I was given.
Right.
That was what, and then every time I kept saying it was my feet, and then they would focus on my back. It wasn't my back. If I could walk my back out.
Exactly. Right. Right.
Obviously I can lose weight. The medication I was taking was causing my weight gain. No matter what I did, there was no quality of my life that was coming forward. It was, and I'm not a negative person, and I kept trying to, but in order for me to do anything with my friends, I had to take medication that would make me like, and that wasn't fun.
Right. And those days are
over.
Over. Thank you so much. Thank you so much, Virginia.
Thank you.
Thanks, Jess.